The doctor is in, and today the topic is an abnormal pap smear. It can be a scary thing to hear that your pap test has been reported back to you as abnormal, but it does not automatically mean that you have cancer. That's the important part. Dr. Scott Ackerman, one of the First Coast's leading oncologists, is here today to help us interpret the results of an abnormal pap smear. And we also welcome a guest who came along with you, Dr. Ackerman. Who'd you bring?
Oh, good morning, Casey. I brought with me today a good friend of mine, Dr. Steve Buckley. Dr. Buckley is a gynecologic oncologist. And so he's first trained as a gynecologist, and then he did advanced training in oncology. But specifically, what he focuses on is the treatment of gynecologic malignancies. So cancers of the cervix, cancers of the uterus, cancers of the ovaries, those sort of things, female cancers. And so he's here with us today.
Well, it's good. I think it's important that people know this, that if you have an abnormal pap smear, that does not necessarily mean that you have cancer, because I know a lot of friends who have gotten that back, and it is a very scary thing. But let's take it back a step. And what are some of the reasons, Dr. Buckley, why a woman would have an abnormal pap smear?
Well, that is a very important point, because a pap smear is not a diagnostic tool. It's a screening test. And so, you know, you can have an abnormality for any number of reasons. It's just a scraping off the cervix. Infection can cause it, viral infections, HPV, pre-cancers called cervical dysplasia, and then certainly, you know, you have to be concerned about a potential cancer, but rarely does an abnormal pap smear mean you have cancer.
And so then, Dr. Ackerman, what will you do, or what will a doctor recommend, or what would you recommend, I guess, after seeing a result like that?
Well, first of all, if you have a pap smear and it's normal, then you continue your normal screenings as you work out with your healthcare provider. But if it's abnormal, if it's any of these things that Dr. Buckley talked about, these dysplasias or these abnormal things, the physician may want to do additional evaluation. And typically, the first step is to do what's called a colposcopy. A colposcopy, which Dr. Buckley does all the time, is where the physician looks at the cervix with a microscope, and he or she is able to see in the cervix where there's any blemishes or abnormalities, and then do a more focused evaluation, a more focused biopsy of those abnormal areas. And by getting a little bit more tissue, and the tissue from the areas that are abnormal, again, it's more focused, it gives us a little bit more information. It gives us information to help us know if this is something cancerous or if this is just something that is inflammatory or infectious, and then make a recommendation for whatever the most effective treatment might be.
Yeah, and then let's talk about treatments, but I would guess that it would depend on what the diagnosis is. I mean, obviously cancer is going to be a much bigger treatment than something else.
Right. Many abnormal pap smears, as we said, are not cancer. So treatment, I mean, many times we can just observe patients and watch them with follow-up pap smears, follow-up colposcopies. If a patient has a significant dysplasia or precancer, potentially it may require excision of the cervix, a limited excision like a conization or a LEEP people have heard about, laser. And then certainly with more advanced problems like truly invasive cancers, that's treated with either surgery or potentially a combination of radiation and chemotherapy, or surgery, and, you know, just depends on the cancer.
There's been a lot of confusion with women, you know, especially with the guidelines, you know, everything from your mammogram to when you're supposed to get your pap test. What do you recommend that women should be doing, and at what age should they start?
Well, there's been a lot of confusion, not just with the pap smear, but we've talked before about mammograms and some changes in those guidelines and changes in the guidelines for prostate cancer we've talked here about before. So same thing with cervical cancer and the pap smear. We used to recommend that women get a pap smear on an annual basis, and that we've kind of backed off from that a little bit. And so it's confusing for me too, and so that's why I go to my expert, Dr. Buckley, to help get through that and sort through that and tell us what's best. So Steve?
Well, I mean, it really is confusing, not only for patients, but for healthcare providers as well. There's a number of different organizations, professional and otherwise, that have their own guidelines. And they typically vary on fairly minor points. But the overall message should be that women should have their annual well-woman exam, which gets them in for an exam and gets their pap smear if needed, and they can discuss that with their doctor. The other very important thing to remember is getting in for that exam also helps screen for other cancers, because pap smear does not screen for ovarian cancer. It's not a screen for uterine cancer.
See, that's surprising.
Yeah.
I did not realize that.
Many patients don't.
Yeah, so then you need to get an additional screening, and that's part of a yearly comprehensive visit.
And that discussion should be with your gynecologist or your healthcare provider, and that's a big part of why we recommend that women see their doctor annually.
Yeah, and also if you have a family history too, that's one of the things that you really need to discuss with your physician. We always talk about knowledge is power, you know, and making sure that your own healthcare advocate on so many things. Yeah. All right, well, thank you so much. We appreciate it. Dr. Buckley, thank you for joining us. Appreciate the guest appearance. And Dr. Ackerman, as always, we appreciate you being here. And thanks to Dr. Ackerman for being here with us. He comes every Friday. For questions regarding today's topic or any other health question that you might have, you can visit his website, firstcoastoncology.com, and confidentially submit your questions to Ask the Doctor. And still to come on First Coast Living, we're going to get a live performance from a local band, the Sun Bears. Don't want to miss that. They're going to have a couple of songs for us. And up next, if you've ever experienced hair loss, don't worry. There are new options out there. We're going to meet Craig, hear how international hair restoration changed his life. That's coming up. We'll be right back.